Closed treatment of the metacarpophalangeal dislocation. 26700. Closed treatment of the metacarpophalangeal dislocation, single, with manipulation, without anesthesia. 26705. A closed treatment of metacarpophalangeal dislocation, single, with manipulation, requiring anesthesia. The physician treats the metacarpophalangeal dislocation using manipulation. Anesthesia may be used if necessary. The physician determines the dislocation position of the bone. The physician uses external manipulation to relocate the bone. The 26700 dislocation is minor and no anesthesia is needed. In the 26705, dislocation is major and the anesthesia is required. Coding tips. When multiple dislocations are treated, report one dislocation treatment as a primary procedure and append modifier 51 to subsequent procedures. According to CPT guidelines, cast application or strapping, including removal, is only reported as a replacement procedure or when the cast application or strapping is an initial service performed without restorative treatment or procedure. For radiological services, see 73120 through 73140. For radiological services, add modifier 26 to identify the professional component, unless the physician owns his equipment. Supplies used when providing this procedure are reported with the A4570. Check with your payer to determine coverage. Terms to know. Anesthesia, loss of feeling or sensation, usually induced to permit the performance of surgery or other painful procedures. Cast, rigid encasement or dressing molded to the body from a substance that hardens upon drying to hold the body part immobile during the healing period. Closed reduction, treatment of a fracture by manipulating it into proper alignment without opening the skin. Closed treatment, realignment of the fracture or dislocation without surgically opening the skin to reach the site. Treatment methods may be employed, including with or without manipulation and with or without traction. Developmental dislocation, displacement of the body part occurring in the developmental phase of childhood. Dislocation, displacement of a bone in relation to its neighboring tissue, especially a joint. Manipulation, skillful treatment by hand to reduce fractures or dislocations or provide therapy through forceful, passive movement of the joint beyond its active limit of motion. Pathological dislocation, placement of a bone or joint caused by a disease process such as infection, lesion, or muscle weakness, and not by traumatic injury. That's your code 26700 and 26705.